Okay, so good morning. Thanks everyone for coming to your open enrollment meeting. My name's Joe. I'm from Lawley Insurance. We're the benefits broker for Medical Health Associates. Everything that I'm going to talk about goes into effect December 1st, 2023, and it will run through November 30th of 2024. So why is open enrollment important? This is your one time per year where you can make changes to your benefits without a qualifying life event. So start to think, am I going to go on a new medication this year? Do I have a surgery upcoming? Is there a maternity planned? Those are all things that could influence what medical plan that you're going to be selecting. Now, things can happen throughout the year. So if you get married, you get divorced, you have a child, those are all qualifying life events. You have 30 days from that event date to make a change to your benefits. So let Sherry and Kelsey know if something like that does happen, and then you can get the change process. If everything's status quo, though, what you decide during open enrollment, you will be locked into for that 12-month period. So what to expect for this year? Health insurance is going to remain with Univera. No changes to the benefits that are offered. You'll still have the 4 medical plans. If you're in a high deductible plan, the health savings account will still be available to you if you want to set aside some pre-tax dollars. If you're in the copay plan or not eligible for the HSA, there's also a flexible spending account. That's the only benefit that will go into effect January 1st. So if you're in the FSA, that's kind of how it's always run. That will renew January 1st, but you're still going to make your elections during this open enrollment period. Your non-medical coverages, so that's going to be the life, dental, disability, vision, will all still be through Guardian with no changes to the rates or the plan design. So pretty much status quo for this year, but it's still good to kind of take a look at your benefits, make sure you're doing the right things. Open enrollment will still be conducted through Maxwell. So if you've been here for a couple of years, you're probably used to the Maxwell Health system. No changes to that process. We're going to be targeting sending out the emails to go into the portal this afternoon. So be on the lookout for some communication on that. You can start electing your benefits. Always good at this time too to take a look at your beneficiaries, even if you're not making any changes. So if you come in and you're like, I'm not changing anything, just review your beneficiaries. There's life insurance that is available. Also, as a side note, 401k, it's always a good time to review beneficiaries if you're in the 401k plan as well. So keep an eye out for that. We do have a new program coming out. So some people may be familiar with Buffalo Rehab Group. They're obviously a local physical therapy organization in Buffalo. They're going to be rolling out a wellness app called Indy, which is, if you're familiar with Peloton or like online app workout programs, very similar. It's developed by physical therapists, low impact workouts. This is going to be no cost to all medical health associates for 12 months. So more to come on this. It's going to roll out December 1st. So once we get everything in the system with them, you'll be getting information on how you can set up your account, utilize the program. We'll look at the data, see how people are using it, and then that's something that we can consider to keep moving into future years. So more to come on this, but exciting that you have a free, no-cost wellness physical workout app that you could take advantage of for this year. Okay, so now we're going to get into the health insurance. So as I mentioned, there's no change to the plan designs for Univera. We're going to run through some just high-level reminders of what is on each plan. And the first couple slides I'm going to talk about are applicable to all the plans. Doesn't matter what one you're on. First is the network. So the network is always the most important part of your plan design. Where can you actually access your care? Univera is owned by Excellis in Rochester. So as a result, you have access to not only the 8 counties in Western New York, but the entire Excellis network. So if you're looking at the screen, the lime green is your local network. So I think with Independent Health Blue Cross, we're used to local being the 8 counties of Western New York. Your local network is going to be 39 counties in New York State, and then there's 4 border counties in Pennsylvania. So you do have a broader local network. If you are traveling, you have kids away at school, you do have access to the Univera multi-plan network. So this will give you access to their national network across the country. Very important though, if you are going to seek care outside of the 39 counties in Western New York, that you are verifying that any provider you're going to participates with MultiPlan. Univera has a network coordinator where if you tell them the doctor you're going to, they will verify that they participate. I just encourage anyone to call the number on the back of your ID card if you're going outside the area, just to make sure that that provider is within the network. But you do have the ability to do that. Preventive services are no cost. Doesn't matter the medical plan, even if you're on the high deductible plan. So it's important to get your routine physical, the blood work, the age and gender-based testing that is available to you. On the slideshow, on the screen here, there's the website to Univera where you can actually get their preventive schedule. Most people print that off, have that conversation with their provider, see what they're eligible for and when, and then start to get that testing done. The idea here is that you're catching any diseases or illnesses that you may have early to avoid a larger claim in the future. So that's why it's important to get this and why it's free for you to do so. One thing to keep in mind, if you're going for a physical, people may have experienced this. Let's say you're going for your routine physical and your throat hurts, doctor runs a strep test, that will flip to a diagnostic service and you will get charged for it. So just keep in mind that stuff like that can happen. Just call your provider. If you disagree, find out why they did what they did. Most of the time there is some reason for it, but be aware that that could happen as you're going to get these services. There's a telemedicine program through the health plan. So this is not new. If you're on the plan today, you may have MD Live downloaded on your phone. It's just another resource for you. You don't need to use it. It's, like I said, it is free to download. It does give you access 24/7 to board certified providers. So if the doctor's office is closed, if you're traveling, if your child is away at school, they have access to a provider that can write prescription drugs. It is nice that you have the Univera multi-plan network. So you have 2 layers where you can access care when you're outside of the area. There is a cost share when you go to use it, just like if you were to go to your primary care for a sick visit. What's nice is if you're on the copay plan, this is no cost for you. If you're on the deductible plan, it can range from $50 to $180. The higher end is more for mental and behavioral health calls, but you're going to be in like the $50 range if you're just calling in for a sick visit, which is less expensive at most primary care offices than going in for a sick visit. I just used this last month. I had a sinus infection. I was at work, stuck into an office, set up an appointment. It took 20 minutes for me to actually meet with a doctor. I was able to get a Z-Pak, prednisone, picked it up on the way home from work. I didn't need to go to the office, and it took me 20 minutes. So there is some value there. If you are in a time crunch and it's something that you can use common sense and talk through with the provider. If you think you broke a bone, having trouble breathing, do not call into telemedicine. They will refer you to the ER and they will still charge you. So you don't want to do that. Question.
If we were to use that, like for someone who's like a complicated patient, does your PCP see any of like the notes or diagnoses or whatever?
Yep. So that's up to you. So if you want to link to your primary care, you can do that. They do recommend it. You don't need to though. Most people will toss in their primary care doctor. And notes will be sent if you allow it.
Okay. Thank you.
Another value added on the health plan. So that if you're on a maintenance medication, so you're filling a drug every month, you can save a copay by moving to mail order. So mail order, you're getting a 90-day supply. You're only going to pay 2 copays, and then as kind of the name. What am I trying to say? Indicates. There we go. As the name indicates, it's a mail order, so it's being sent to your home. You can choose Wegmans or Express Scripts for your mail order services. Not every drug is eligible for this, so even though you may be filling a drug every 30 days, may not be eligible, but worth a call. You save a copay. Just keep in mind that you do pay those 2 copays up front, though. So some people don't like that because you're fronting 2 copays to get that savings on the back end. So just keep that in mind. It's not for everyone, but it is there if you want to take advantage of it. And then the Wellness Your Ways, I already kind of touched on this, but you do have the option to earn up to $250 if you're a single. If you have your spouse on the plan, another $250, so up to $500 as a family if you have your spouse enrolled. You do have to have your Univera member account established. So if you don't have that, you probably don't know what I'm talking about right now. So you do have to go in there, claim your reward, and then you get the money, and you could use it on a variety of wellness activities. So just make sure you do that. If, like I said, if you're on the plan today and you haven't done it, there's still time to do it for this current plan year, and then it will be available for you in the next plan year. There's also dental rewards that are available to you. So similar to the wellness, you can get $150 if you're a single, and then another $150 if you're spouse. So combined $300. So this is if you're just getting your teeth cleaned. And if you're on the dental plan, that is no cost to you to begin with. But even if you're not on the dental plan, you can still submit through this and get reimbursed for your services. So these are two programs that Univera is trying to incent healthy behaviors, and they're giving you funds to do so. So make sure you're taking advantage of that. If you have any questions on this, feel free to let me know, and we can talk about how to claim those funds for you. All right, so now going into the medical plans. First plan is the copay plan. It's a pretty straightforward plan. There's no deductible, no co-insurance. You're just paying the copay at time of service for both your medical and your pharmacy claims. Like I said, this plan's the most expensive out of your paycheck. So, some people like the comfort of having just a fixed copay. You know what your cost is right away, and you're willing to pay maybe a higher premium for that. Some people may be a little overinsured by doing this, and that's okay. It's based on your comfort level. There are a couple plans that we're going to run through that could reduce your out-of-pocket cost. And then we'll talk about how you can take that savings from the medical premium and use a health savings account to save for your claims now and in the future. Just a high-level overview of the high deductible plans and how they work visually. So preventive services are covered in full. So like we talked about in the beginning, those services are carved out, no cost to you. What you're going to be responsible for in a high deductible plan are all of your diagnostic medical services and your pharmacy claims. So you're going to pay the negotiated rate that Univera has with the provider or facility that you're going to on the medical side. And then on the prescription drug side, you're going to pay the full retail cost of the medication up until you hit your deductible. And then we're going to move to copays for 2 of your deductible plans. And then 1 of your deductible plans is covered in full after you hit your deductible on the medical side. Pharmacy will have copay. So the mechanics of the next 3 plans are all the same. It's just what deductible level are you comfortable with? And then we'll talk about how you pair it with a health savings account. The first deductible plan is the Signature Deductible 4. This has a $1,500 single deductible, $3,000 family. You'll see next to the deductible, it says True Family. So one person on your family can satisfy that entire $3,000 deductible. There's no co-insurance, and there is an out-of-pocket maximum on these plans. So, there's a lot of misconceptions in the marketplace on high deductible plans. You may have, heard stories of people getting $10,000, $20,000 claims in the mail, and it certainly is realistic if you go out of the network. But if you're staying within the network, there are some protections built in on these plans to give you what your all-in number is, your maximum for the plan year. With this plan, it's $5,000 if you're a single, and it's $10,000 if you're a family, but one person's capped at $6,550. So there's a per person cap on the plans. Once you hit your out-of-pocket maximum, all of your medical and pharmacy claims are covered in full. That's assuming that you're going within the network, and then you'll see the out-of-network benefits to the right. Dropping down into the service categories, prescription drugs post-deductible will be copays. So it's $10, $50, or $100. We're getting back to that copay style plan that we first talked about. And then you'll see what your medical services are post-deductible. So like I said, you get back to the copay, you just have that upfront deductible that you'll need to be responsible for. Most people that look at high deductibles, you're relatively healthy. maybe a little bit on the younger side, but that, the age doesn't really matter. If you're in good health and you're willing to take on that risk of the deductible, knowing that you're going to be saving some money on the side, deductibles can make sense for certain people. Happy to talk about a lot of this is one-on-one conversations that we can have to figure out what plan makes the most sense for you. So happy to stick around and have those conversations with you. The next deductible plan is the Signature Deductible 4. So same plan name, just a different deductible level now. So it's $3,000 for a single, $6,000 for a family. There's no co-insurance, and the out-of-pocket maximum is the same. So it's this really the same plan design, just the deductibles higher, and then everything is going to be co-pays post-deductible. So you're paying the full retail cost of your prescription drugs. You're paying the negotiated rate that Univera has with the provider or facility that you're going to until you hit your deductible, and then you go to co-pays post-deductible. The last deductible plan is the Signature Deductible 3, also a $3,000, $6,000 deductible, but you'll notice on the medical, your services are covered in full post-deductible. So that's the difference between the two $3,000, $6,000 plans, is that this plan, your medical services are covered in full post-deductible. So if you're someone that doesn't like the copay plan, maybe you have a surgery coming up or a maternity claim that you know about, maybe this deductible plan makes sense for you because once you hit your deductible, at least your medical services will be covered in full post-deductible, and then you'll have co-pays on the prescription drug side until you hit your out-of-pocket maximum. So like I said, all the plans really work the same way on the deductible side. It's just what's the deductible, and then there's some nuance in what's the co-pay post-deductible. Any questions on the 4 plans? Yes.
It's kind of a 2-part question. So the first part is if you have 2 people that are within the same company that are married, that have 2 separate plans, and we're expecting an infant in the near future, that infant can be added to either or plan?
Correct.
Okay. And then if the one person has a deductible, does that then renew the deductible for the life-changing event, or just it add the additional 3? Like if we do the 3,000, does it add an additional 3,000?
Yes. So you would go from single to family.
Okay.
Yep.
And so if I had met my deductible at 3,000 prior to baby being born, it would just increase it by 3,000?
Yep.
Okay.
Yep. Yeah. And if that does come to fruition, we could talk through that. There's a lot of moving parts with that, but
Right.
Theoretically, yes, that is how it would work. Okay, so then getting into the some of the online tools that are available to you with Univera, it's important to make your account. I know a lot of people don't do it, or you do it and you don't go in. You go in once a year to do it to check what's going on. I'm guilty of that, and I talk about this stuff all day. So I assume a lot of people don't go in, but there is some good stuff, especially this time of year. You can claim your rewards, so that's the number one thing I think most people would go in there for. Go to the next one. You can check your deductible levels, or your claim spending in general. So if you're someone that is on the copay plan, and sometimes we forget how many times did we actually go to the doctor this year? How many times was I actually sick? And the Univera website tracks that for you. So maybe if you're not in the right plan, the data will help you make a decision to go to the high deductible plan, or vice versa. If you're in the deductible plan and you like, wow, the last 3 or 4 years I've hit my deductible every single year, maybe that will tell you, hey, I need to get into the copay plan because I'm a high utilizer. So it works both ways, but the data is there for you. And then if you download the app as well, you have your ID card right on your phone. So that's always a plus, just to make sure you have all your tools ready and available for you when you need them. Okay, so any questions on the Univera medical plans, some of the value adds? Okay. Just a show of hands in the room, who is in the high deductible plan? Wow, look at that. So I'm going to be preaching to the choir here. So hopefully if you are in the deductible plan, you do have your health savings account. I'm going to go over, obviously with the sake of the recording, I'm going to kind of walk through the slides still. But a health savings account, a lot of people, I always think of this as my healthcare 401k. So everyone's familiar with your retirement account. This is, in my view, what you're doing to save long-term for your your medical expenses now and then in the future. So it's a completely tax sheltered account. The funds go in on a pre-tax basis. As the money grows, you don't pay tax on it. And then when you spend the funds on qualified expenses, you also don't pay tax. So it's a really nice account from that standpoint. We'll go over what a qualified medical expense is, just so we're all on the same page. Advantages, though, so you own this account. This is not an employer-owned account. Employees own the account, which gives you flexibility in what your payroll deduction is. You can change that throughout the year. Some people are familiar with a flexible spending account where you're locking in up front, and then you don't have any flexibility with that amount that you elected. The HSA gives you a lot of flexibility to, move up and down what your payroll deduction is. We see some people where, all of a sudden you learn that you have a medical expense upcoming and you really want to max out your HSA to use the pre-tax dollars. You can do that mid-year if you wanted to. If you were to ever leave MHA for whatever reason, the HSA account goes with you and all the funds in it goes with you. So you're never at risk of losing the funds that go into the account, which is really nice, and it gives people some comfort knowing that. There are some eligibility requirements, so you have to be in a high deductible plan. So if you're in the copay plan, you cannot open up a health savings account. We're going to talk about a different account that is available for you if you are in the copay style plan. Medicare is the end game of the HSA. You can kind of think of it that way. Once you age into Medicare, the automatic is Part A. Your contributions have to stop. You don't lose the funds, but that's just when the contributions have to stop going in. If you're covered by other health insurance or claimed is dependent on someone else's tax return, you also cannot contribute to a health savings account. Just another scenario too. So let's say you go into the high deductible plan and I come back here next year and you say that was a terrible decision. I shouldn't have done that, but I put $1,000 into the account. What happens with the money then is you just can't put more money into your HSA if you go back to the copay, but you can use that $1,000 to spend down your copays or just let it sit there. It's up to you, but there's no way to lose the money. So that's what the point I'm trying to get across. The IRS sets the limits on what you can put in your health savings account. It's very small font. So your medical plan renews on December 1st. The IRS sets these thresholds on a calendar year, so January 1st cycle. 2024, it's going to be $4,150 if you are a single, $8,300 if you're a family, and if you're over 55, you can do an additional $1,000 called the catch-up contribution. So just keep those in mind if you're someone that likes to max out your HSA. Keep those numbers in mind. Luckily, Maxwell, when you go to enroll, will not let you go over those amounts, but just keep that in mind if you're just doing any budgeting on the side outside of Maxwell. So what is a qualified medical expense? If you want to get technical, you can Google IRS publication 502. Generally speaking, it's going to be all of your medical expenses, so deductibles, co-insurance, co-pays, prescription drugs. You can also use non-dental and vision services as well. So if you're incurring any dental cost or eyeglass cost, you can use your HSA to pay for those expenses as well. There's also a website called hsastore.com, which has a bunch of over-the-counters that you can purchase. And it actually has an easy-to-sort list of what is an eligible expense. So if you're just curious on, is this eligible? I always go to that website, type it in. If it's on there, I know that I'm more than likely can use my HSA on it. But I have a 4-year-old and a 1-year-old, so I just stocked up on HSA Store on my Tylenol, Motrin, cold and flu stuff. So that website's there if you want to take advantage for over-the-counter. But the nice thing with the HSA, you don't need to spend the money. It's not like the FSA where you see people going to those websites and spending their funds down. You don't need to, but it's there if you have a need. I mentioned that you own this account in the beginning. It also means that you have to manage it the right way. So if you do use the funds on a non-qualified expense and IRS audits you, you will have to pay back a penalty and then whatever the funds were. If you open an account through HSA Bank, you won't have to worry about that. The cards are smart enough to know what is qualified and what is not. But if you're opening an account at a bank of your choice, you may run into that issue.
Question.
Yes.
There's no beneficiary designation for an HSA. What happens?
With HSA Bank, there should be.
The bank,
Yep. So if you log into your account, there should be a beneficiary section in there.
Good.
Yeah. So that is important because some people do carry high balances in these accounts. So just make sure there is a beneficiary spot. I can't say that for banks though. I don't know how, if you go to a brick and mortar bank, I don't know how they handle that, but I would assume there has to be some sort of beneficiary to list.
Do you know any of the bank charges that they charge you monthly?
Which
For
one?
The HSA bank?
I don't know off the top of my head, but I want to say, and don't hold me to this, but it's about $2, anywhere from $2 to $2.50 is likely the admin, per month.
Do you know if there's a limit that stops at? Like sometimes if it's like $1,000 or higher, they don't charge that at some banks. I was just wondering if this.
Yeah, don't know. I don't know the details. I haven't looked at that in a couple of years, but I can look into it and let you know what the fee structure is on HSA Bank. All banks, will charge admin fees on these accounts, so just keep that in mind. But to your point, if you have certain balances, they'll waive what your admin fee is. And just something else on the HSA is getting like really into the weeds, but it's important if you are someone that has high balances, you do have the ability to invest your funds into mutual funds. HSA Bank has a method for you to do that if you want. You do have to have a certain balance threshold. So you can go on the website, you can kind of play around with it if you have an account. But I think our team at Wally recommends that if you have a balance less than like 10,000, that you probably shouldn't be moving the funds over to investment accounts. So just keep that in mind, but it is there for you if you need to. Any other questions on the HSAs? Okay, so now we'll talk about flexible spending accounts, very similar to the HSA, but there are some key differences that we'll talk about. This is ideal for people that are on the copay style plan. This is a way for you to use pre-tax dollars to pay for your healthcare expenses. There's also a second layer to this, which is open to anyone. Doesn't matter what plan you're on. It's a dependent care account. So if you have kids that are under the age of 13 in daycare, before and after school programs, summer programs, etc., you can use pre-tax dollars to pay for those expenses that you incur. So what is a qualified expense? It's actually the same listing as the HSA, so IRS publication 502. So, medical copays, dental, vision, the same exact stuff that we just talked about in the HSA. And I already mentioned what you can use it for on the dependent care side. If you have a health savings account, you cannot also have a flexible spending account. However, if you have a health savings account, you can have a dependent care account. They're two separate lists that the IRS published, which is why you can have both a HSA and a dependent care FSA. So similar to the HSA, the IRS sets the maximums on the FSA. It's $3,050 for 2023. The IRS hasn't released what the 2024 amounts are yet, anticipated to be $3,200. But when you go into Maxwell to enroll, just to be on the safer side, we have it set at the 2023 maximums. If you are someone that maxes out your account, and the IRS, in the next 3 weeks, they should come out with what the 24 maximums are. We'll reach out to you and ask if you want to bump up to the 2024 amounts. Just keep in mind with the FSA, this is a use it or lose it style account. So make sure you're budgeting appropriately. I always tell people the first year in, be conservative on what you're going to be budgeting, because you don't want to be in that situation where you're going to FSAstore.com or you're buying a bunch of stuff that you don't need because you don't want to lose the money. But just keep in mind that you have until a grace period until March. If you're currently in the plan, March 15th of 2024 to submit your claims, and that will be March 15th of 2025 when you're electing for open enrollment next year. So you do have a little bit of a grace, but you don't want to be in a situation where you're trying to spend down funds. For the dependent care, actually, let me back up to the FSA. The FSA, one of the nicer things about this account is you're fronted the money. So if you elect $1,000 in your FSA, January 1st, you will have $1,000 made available to you, and then you will pay that back through payroll deduction. So take, whatever your amount is, divide it by 26 pays. That's what will come out of your paycheck to pay back the FSA. Kind of think of it as an interest-free loan, if you will. The dependent care works slightly different. You can only use what you accrue in your account. So if you elect the $5,000, take that divided by 26, that's what's going to go into your dependent care account on a per pay basis. Most people will pull these funds every 6 months, every month. I have a dependent care account, and my wife and I will pull it November 15th, and then again before the year ends. And we use that as our Christmas money. We're not, that's what we use to save for spending money around Christmas time. You can use the money on whatever you want. We don't see a ton of utilization in the dependent care account because, using daycare an example, you are paying daycare and also having money taken out of your check to pay for daycare. So you're kind of double dipping, which is why we don't see a ton of utilization, but it is there. If you want to take advantage of it, you can reimburse yourself monthly if you want to get on a higher frequency or even a per pay. But it is there. If you're a single or married and file a separate tax return on the dependent care side, you can only do $2,500. So just keep that in mind. Any questions on the FSA? All right, so now we're going to kind of kick it into gear here. You do have employer-paid benefits that are paid for by the practice. These are benefits that hopefully no one ever has to use while you're here. But if something tragic happens, if something catastrophic happens, and you can't come to work, there are benefits for you. There's life insurance. All your specific benefit will be listed on Maxwell. So I'm going to talk very high level about these. When you go into the portal, you'll see what your life insurance benefit is, what your STD, short-term disability benefit is, and your long-term disability benefit is. So these are all paid for by the practice. On the life insurance side, just make sure, even if you don't take any benefits, you're automatically enrolled in this stuff. You want to have your beneficiary listed. Even if you waive everything, just go in, update your beneficiary before you check out. And then it's just nice to know that if you go out into disability, there is some paycheck insurance. That's what the disabilities, you can kind of think of them are as insurance for your paycheck if something were to happen to you. So really good benefits. Not a lot of practices offer this to their staff, so it's good just to highlight these and let you know that they're out there for you. If you want to supplement your life insurance, there is voluntary term life insurance available to you. So if you want to go more than what your employer paid life insurance benefit is, you can increase that. You can go in increments of 10,000 all the way up to 500,000. There are caps on it, so you can't go more than 5 times your salary. Maxwell will make sure you don't over-elect to, so you're not out of line with what the contract provisions are. If you insure yourself, you can insure your spouse, and if you have children or multiple or one child, you can insure them. One thing to note on the voluntary life insurance, if you waived this benefit last year or when you were first eligible, you will have to complete what's called evidence of insurability. So it's like a 5-6 question health questionnaire. You don't have to get any medical testing done. You just have to fill out the questionnaire. If for whatever reason you get denied, you don't lose the employer paid. So you just don't get the additional term life insurance. If you currently have the benefit, the voluntary life insurance, let's say you have 40,000 and you want to go to 50, you'll also need to complete evidence of insurability. If you get denied, you keep what you have. So whatever is on the books, you keep, you just don't get what you're asking for. So a lot of people think if you get denied, it jeopardizes everything else. So if you want to apply, it's a pretty simple process, but just know there's going to be 2 steps for you. Elect the benefit in Maxwell. You'll get a prompt that tells you to complete evidence of insurability, complete that, and then Guardian will approve or deny your request. Any questions on that? Yes.
Is it portable, the life?
Yes. So the life insurance, if you were to leave the practice, you can take that with you, and you can port it right to term life insurance. There's also conversion options. Most people don't take advantage of the conversion, so you go from term life to whole life. Based on your age, it may not be. It may just you may be priced out of purchasing it if you go to leave. Next slide. All right, so then getting into the dental. So dental is broken down into 3 categories: preventive, basic, major. There is also orthodontia, but that's pretty self-explanatory what that covers. this slide here, if you're following along in the paper copy, gives you just a breakdown of what is in each category. So when we go to the next slide, you kind of have an idea of what I'm talking about. You have 2 dental plans. And again, there's no changes to these benefits. So if you wanted to stay status quo, you don't need to change anything. Your cost is going to stay the same as well. Guardian's the dental carrier, just like it was last year and in years past. Preventive services are covered in full. So if you're going for you get teeth cleaned every 6 months, x-rays when appropriate, no deductible, covered in full for you. Basic care and major care, you're incented to go within the network. So 90% coverage if you're within the network. On the high plan, 60% for major. You'll see what the out-of-network benefits are. So there are out-of-network benefits. We're seeing a lot of dentists not wanting to accept any insurance lately. It's just we're seeing the numbers go down and down on dentists that want to contract. It's not with Guardian, it's just it's just an industry-wide problem that we're seeing. So just know that there is coverage for you. There is a deductible that kicks in if you go out of network. So just keep that in mind. Try to go in network when you can. It will save you money in the long run. The annual maximum on the high plan is $1,500. So that's when thinking about the medical out-of-pocket max. Once you hit that, you stop paying. Dental's the opposite. Once you hit the annual max, Guardian stops paying. You pay everything above and beyond that. Guardian has a nice program. It's called Maximum Rollover. So that's just your starting point. Some people in the room will have different out-of-pocket maximums based on if you've qualified for the rollover program in the past. So essentially what that is if you submit at least one claim, so you just go for one of your preventive teeth cleanings, have less than $500 in services in the year, Guardian will roll over $350 if you went to an in-network dentist, $250 if you went out-of-network to the next year. And that will compound, year over year if you qualify for the program. So, and that's also within your family. So if you have a family plan, each person in your family has their own unique annual maximum. So some people in your family may have different maximums as well as a starting point. To see if you've qualified, you can go to guardiananytime.com. So they have a member portal as well. Log in and see if you've ever qualified for the program. As I mentioned, there is ortho coverage on this plan. So it's 50% to $1,500. That's a lifetime maximum. Just keep in mind, orthos for children to age 19. Preventive, basic, major care for your dependents are covered to age 26, regardless of their student status. And the next plan is going to be the low plan. So obviously the high plan is going to be more expensive. You have more coverage. The low plan, this may be someone that is only concerned, you just want to get your teeth cleaned and have coverage for the occasional filling that you have to get. Not really concerned about basic and orthodontist services, although these plans will have those coverages. It's just going to be a little less than the high plan. So it's really going to work the same way, just the percentages are different. It's still incented to go within the network. If you go in the network, there's no deductible. The maximum is $500 less. So at $1,000, still has that rollover program that we talked about. And there is ortho services, but that lifetime max is cut in half to $750. So if ortho is the main reason or the only reason you're going to be buying dental, the high plan would make sense for you because you don't get that big of a benefit on the low plan. And same rules apply on this plan for your dependents as well. You have 2 vision plans as well through Guardian. So the way it works with Vision, Guardian's your insurance carrier, and then you have 2 different networks that you can pick from. So there's a VSP network and there's a Davis network. The plans are pretty much identical in design. VSP, you are going to get a little bit more on the frames than Davis, I believe. But otherwise, it's like a $10 difference. So it's really not that big of a difference between the plans. VSP is known for their relationships with their individual optometrists, mom and pop shops. So if you're just kind of thinking broadly, that's where you can kind of think with the VSP network. Davis, on the other hand, is known for the relationships with big box retailers, so Target, Walmart, BJ's, Penny's. Ton of overlap between the 2 networks. So they're both of these are in the top 3 networks across the country. If you're new, trying to pick what vision plan to go into, I would just call your eye doctor, ask them who they participate with, and make your decision based on that. There is out-of-network coverage on the vision plans for both, but it's very minimal coverage. Sometimes you're better off if you're knowingly going to go out of the network. It's better off to not even buy the insurance to begin with. So try to go in network if you're going to purchase it and have money coming out of your paycheck. Any questions on either of the plans? Okay. Yeah. All right, so the last three benefits we have, these pair well with the health insurance, specifically high deductible health plans. I think everyone might be familiar with Aflac. So these are, you can kind of think of these as Aflac similar products. So there's an accident plan. There's three different plans for you to pick from: a Premier, Advantage, Value. Each will be a different cost, Value being the least expensive, Premier being the most expensive when you go to Maxwell. I know we don't have a lot of detail on the screen, but when you go into Maxwell, essentially what an accident plan does is if you have an accident out of work and you have to go seek medical treatment, Guardian will reimburse you a dollar amount for that service that you had. So most popular use of this benefit is going to be kids that play sports. Most of the time, I think if you were to ask Guardian, about 80% of the people that purchase this product have younger children that are on the plan. And, if you go to an urgent care, you get like $75 back. So it helps offset your cost. Like I said, the benefits summary on the portal, when you go to look at it, it's going to be pretty long because it's just like a medical benefits summary. It's going to list a bunch of services and it will have a dollar amount. That dollar amount is what you would get reimbursed if you incurred a service, and you can use the money on whatever you want. It doesn't need to go. The intention is to offset your medical costs, but if you have an accident and you're out of work, maybe you got to pay the rent or the mortgage, et cetera. That's what these benefits are for. Question.
Is there a limit? Is there a maximum amount that they would pay? What if you're accident prone?
Yeah, so there are some limitations. The summary will list that. So if it may be limited to maybe like one hospital accident, or like there will be a limitation on.
And that'll be on the.
Yep, the benefit summary. It's a very detailed summary. So if anyone has questions, happy to walk through it with you. The next plan is going to be critical illness, specified disease. So this is going to be, so the accident is very broad in scope of what it will cover. Critical illness is very narrow. It's a very specific list of conditions that you will have coverage for. They're listed on the screen here. You can purchase a lump sum of anywhere from $5,000 up to $20,000 for this benefit. Most people, it's not a very utilized benefit. Most people don't purchase it. Where we see it is if you have a family history of any of these conditions listed on the screen, and you want to make sure you have some peace of mind or protection in case something does happen to you down the line. That's what this is for. Otherwise, if you don't have any concerns, we really don't see people buying this. It's an age banded benefit, so the younger you are, the cheaper it is, and it just increases because it's an underutilized benefit. Guardian does have a wellness plan built into this. So if you're going to get your routine physical or any of the routine preventive schedule, you can get back $50 per year for this plan. And that's just to help offset it and help you remember that you have this benefit if you did purchase it. The next plan is going to be the hospital indemnity, where we see this plan being used the most. So if you're going to be admitted to the hospital, you get $8,000 lump sum benefit returned to you. Same thing for ICU admission. So this one does have some limitations, one per plan year. So just keep that in mind. You can't use multiple admissions per year for the same person. Most popular use of this benefit are for people that are expecting to deliver a child, or if you have planned surgery that will be an inpatient stay in the hospital. That's where we see people purchase this. You have to think ahead, though. So there are look backs on this plan. For maternity, they're going to look back 9 months from the effective date to see if you were pregnant during that time. And if you were, they'll deny the claim. And then on the for non-maternity claims, they're going to do a 3-month look back before they will pay claims. So just keep that in mind if you're going to purchase these products. Wally offers this to us. Ours is a $2,000 benefit. Quick story, because I never was a believer in this product until I purchased it. My wife and I were expecting our second child, so I was forward thinking, and I was like, I should probably buy this because we have a $10,000 deductible at Wally, so I have a lot of exposure on the deductible side. So I bought it, and we went into the hospital. We delivered. I was reimbursed the $2,000. So we have Guardian as well. It worked probably 3 weeks. I had the money back. Unfortunately, a week after we were discharged, my daughter spiked a fever. We were back at Children's for 7 days. Another claim. But now that my deductibles hit at that point, so I just had about 12 days in the hospital at Children's. It was a pretty expensive bill, but I had $4,000 to help offset that $10,000. So using my example, you don't know what's going to happen, but if things could happen at any time, and you could use it. And just to kind of round out the story, so you can use this benefit one per year. That's the same as what Lolly's is. January 2nd, my wife had to have emergency gallbladder surgery, was admitted to the hospital. So we used it twice on her in 6 months. So it did work. And so $6,000, unfortunately, but that comes at a high medical cost. Like like I said, you can use the funds on whatever you want, but there is some value to these plans. Premium's a little bit high, but if something's coming up, it might be nice to get that kickback on the inpatient admission. Question.
Well, it says pre-existing condition. So I have a history of, I've got 3 hip surgeries, 3 knee surgeries. Let's just say something happens and I have to go in for a separate, let's just say knee injury that puts me in a hospital. Are they going to look back at all those injuries and say we might not pay?
Yeah, so what they'll do is they're going to look back 3 months. So if you enroll 12/1 of this year, they're going to look back to, so would that be September 1 of this year. And if you had any ongoing treatment that resulted in your inpatient stay, they will deny the claim.
Okay.
But if you had a hip surgery, I don't know, a year ago, and then you're going in and, maybe there's an issue, I don't know what it could be. They wouldn't, and there was nothing ongoing in that 3 months prior, they would pay the claim. So it's just in the most recent 3 months.
And what about chronic illness? So let's just say I have rheumatoid arthritis and something happens that puts me in a hospital that's related to the rheumatoid arthritis.
I'm going to look into that one because technically, the way that the contract is written is in the last 3 months, you're probably taking medication to treat.
See rheumatology every 3 months.
Yep. So, and where I'm thinking is that might exclude that specific. But that's a good question. Is that how you can kind of think of it that way? If you have anything going on, I will connect with you after. I'll get your email, and then I'll get an answer for you.
Thank you.
Okay. And then lastly, if you are aging into Medicare, if you have any friends or family that are aging into Medicare, we have a team at Lolly that can assist you or someone in your family going through that process. It's at no cost to you. So just because you're employees of MHA, we waive any cost that we charge. If you live in the South Towns, we have an actual brick and mortar office in the Southgate Plaza, or if you want to just make the ride over there, you can go in and meet with April. She's really good, though. She'll actually come to your house if you have her, or she can come here and have the conversations with you. But when you're going into Medicare, it's more of a personalized conversation about what's going on with your specific conditions, what your concerns are, to pick a plan that makes the most sense. So she's there for you if you need to take advantage. You can call her, but most of the time it works best if you go to HR, Sherry or Kelsey, and then we'll connect you with April that way. Okay, so that's everything that I have. Be on the lookout for the Maxwell email later this afternoon. You can go in, start electing your benefits for this year. Again, just keep an eye on beneficiaries, make sure they're up to date. If you have any questions on anything, feel free to reach out to Sherry or Kelsey. On Maxwell, you have direct access to us too. So if you have any questions, there's a help type email that comes right to us at Lolly. So just let us know if you have any questions on anything as you're going through the process. Okay. Well, thanks to everyone. Thanks for listening.
Thank you.